guys, it's Nurse Squatty. Let's talk about the trauma triad of death. These are three things that we see happen in our trauma patients that directly contribute to their poor outcome. And it's coagulopathy, acidosis, and hypothermia. Let's start with coagulopathy. Well, that's the problem in our trauma patients. They have a huge laceration and they're pouring all their blood out of their femoral artery, or they've had a blood force trauma to their abdomen and they're bleeding inside their peritoneal cavity. But these patients are bleeding faster than their body can form clots to clog up wherever they are bleeding. And of course, if they're losing their blood volume, that's directly going to contribute to their death. Hypothermia. Now, the hypothalamus is what controls our temperature regulation in our body, and our patients with traumatic injuries can become hypothermic. Either it's our fault because we get them trauma naked and then we put them on a super cold long spine board that's sucking all the heat out of their body, or they're laying on the cold ground until someone finds them, or if they've got brain trauma, that's going to affect that hypothalamus, which is going to cause them to be hypothermic. Now, this is going to worsen acidosis because these three things, they all play into making each other worse. And that hypothermia, what's our blood volume do? Yeah, it wants to shunt to the core to keep it where it's nice and warm, and we have poor perfusion to the extremities, and that's going to worsen our acidosis, which in turn also worsens coagulopathy. Now let's go to that third one, acidosis. So we know that cellular respiration or cellular metabolism is when we bring oxygen and glucose to the cells, we metabolize it in the mitochondria, powerhouse of the cell, and we turn it into ATP or energy. But in our bleeding patients, we're not able to bring blood, we're not able to bring oxygen to the tissue in order to metabolize it. And so we have to go into anaerobic cellular metabolism, which is much less effective. And now the waste product is lactic acid, which is going to lower the patient's pH. They're going to be acidotic. Now, we have the power to either make these things worse or make them better. We can worsen hypothermia by giving these patients a paralytic, and now they can't shiver, which is your body's way of trying to warm itself up. We can worsen acidosis by not improving the patient's perfusion, and we want to give blood products. Now, there's a little asterisk. We want to also tip our hat to hypocalcemia, because when we're trying to fix that coagulopathy by giving plasma and then giving red blood cells, what's that preserved with? Citrate. That citrate is going to bind up the calcium in the body, and calcium participates in that coagulation, those forming of those blood clots to try to stop that bleeding. So we've got to remember that if we're MTPing, if we're massive transfusion, we're giving a whole bunch of units of blood, usually every 2 units of packed red blood cells, we're going to give some calcium to help offset all of that citrate. Now, if you're giving your blood slow rolling, if say a GI bleed or whatever, this concept does not apply to those patients, because your liver metabolizes all of the citrate in 1 unit of blood in 5 to 10 minutes. So there you have it, a really quick 10,000 foot view of the trauma triad of death.